Rob Carter.
Hi, everyone. Mr. Chairman, members of the committee, thank you. Good to see everyone. I am Rob Carter. I'm the Commissioner, Department of Corrections. I brought my entire department, in case you're wondering, behind me here. Yeah, come on up. I've got a short presentation, but at any time during my presentation, feel free to stop me and ask me questions. Or at the end, if you have any questions about what we're proposing, just let us know. Christine Regal to my right is my CFO. I've also got Deputy Commissioner Jim Basinger, Operations, and my Chief of Staff, Randy Custer.
Todd, are these yours?
And Deputy Commissioner Julie Lanham for reentry. Okay. Oops. Our mission is we promote public safety by providing meaningful, effective opportunities for successful reentry. And our vision, as a model of best correctional practices, we strive to return productive citizens to our communities and inspire a culture of accountability, integrity, and professionalism. This is a map of our adult facilities. We have 17 total adult facilities across the state of Indiana, and they are pretty well spread out in different areas of the state geographically. This is a current map of our juvenile facilities. We have 4 juvenile facilities total. 2 are actually in Logansport. 1 facility in Logansport is our intake unit. We have 1 female juvenile facility up in LaPorte, Indiana. These are our parole districts that are spread out through Indiana. We have 10 parole districts across the state of Indiana. Currently, there are 61, roughly 6,100 offenders on parole. This, I'm going pretty quick, so stop me if you have any questions, but this will give you an idea of our population, current population, our trending, where we're at, where we're going. As you can see, during the 14, 15, and 16, it went down a little bit because of House Bill 1006. As you can see, we're slowly trending back up. We're roughly at 27,000 offenders. Top graph is give you an idea of the F6 reimbursements that we pay out to counties. We have in the neighborhood of 2,500 offenders in county jails that we reimburse through a billing system. The bottom slide is community corrections population. We're just south of 20,000 offenders that we utilize community corrections with, so that's felons, misdemeanors, and then there are also pretrial detainees that are assigned to community corrections, sometimes through electronic means. We have 89 community corrections programs throughout the state. There are only like 3 counties that aren't participating in community corrections: Newton, Benton, and Franklin County. The rest of them pretty well have some strong programs. Of those 89 programs, we have 31 jail treatment programs, and we're trying to kick that up a little bit to get more sheriffs involved in the jail treatment. I had some of my staff at the sheriff's training, newly elected sheriff's training last week, and we pitched that idea to the new sheriffs. There are 51 new sheriffs, so we got them up to speed on some of the good stuff that we're able to do. This is a summary of our change package, and I'm gonna say a little bit about what we're currently doing, then I'm gonna turn it over to Christina. But we are really trying to utilize some of our dollars to train up offenders before they get released. One thing that we didn't do a very good job in the past was we would just release them to their parole agents and then Parole agents would spend a lot of time, the hire program would spend a lot of time trying to find these individuals jobs. Now we found that the secret is to get them trained up, get them certified, get them a certification, a high-end certification before they get released. So, so far we've had 300 inmates go through a certification process. We've awarded over probably 2,000 certifications already, and these are high-level jobs. We're utilizing Ivy Tech for a lot of this programming, and we're very fortunate to have Ivy Tech in the state of Indiana. It's a lot of states don't have a community college system that we do. We've got a strong community college system, so we used to have a relationship with them, and we've re-energized that in the recent years, and so that's become very successful. We don't have the data yet to show who all is getting jobs yet. A lot of them haven't been released, but they're getting their certifications. But the ones that have been released, the pay is really good. It's actually a living wage for the first time. So they get hope when they get out, and we're really proud of our efforts there.
Thank you. Hi again, I'm Christina Riegel. I'm the Chief Financial Officer for DOC. I'm going to try and keep mine pretty much as short and sweet as Commissioner Carter did. You'll see our actual fiscal year 2019 appropriation was just over $739 million. What we've submitted for fiscal year 2020 is $752.6 million, and for 21, $755.5 million. That's about a 2% increase over our current appropriation. Fiscal year 20, it's just under 2% increase. Fiscal year 21, just over 2%. The majority of that is for the 3.3% increase in personal services that you've likely seen from other agencies that was in our budget instructions to allow us to not have to fully absorb those pay for performance increases each year. The other areas, like Commissioner Carter touched on, obviously continue pushing forward with those nationally recognized industry certifications. We're really excited about the governor's announcement to bring hire over to DOC, the Hoosier Initiative for Reentry. I think where it's going to help us really do a lot of work of getting offenders jobs before they even leave our facility instead of doing work once they've been released to parole. A continual focus for us is staffing levels, and for us to try and reduce vacancies within our correctional facilities. We have made some pretty good strides in that area, but we hope to continue to make those same strides. And then the last little bit is for contractual CPI increase obligations that we have written into our 4 major contracts. I'd like to open it up to any questions.
This is a big agency. We've got a lot going on, a lot of moving parts, and if it takes another meeting with any of you, just let me know. I'm easy to find, so if there are questions that, I got plenty of staff here, we'll try to answer questions now, but if there are any other issues that may pop up, just let me know.
Thanks, Rob. You mentioned you're showing your graph a reduction in your population, and I know the locals are really complaining about big increases in their population. So, I mean, wouldn't you see a reduction in your expenses because of that reduction in your population?
I'll turn that on my CFO.
We did for a short time. As you saw those decrease, we were able to, so we've got, as an offender doesn't come to us, we save on their food and medical, and then, clothing and things like that. So until we see large populations not coming to us, we don't have huge savings because we've still got the overhead of our custody officers and such. But we did, obviously, as the population declined, we saved on those major contract areas. As the population goes back up, though, we're starting to see those expenses come back towards us.
Thank you. Any questions? Jason?
Thank you, Mr. Chairman. Commissioner, on the slide related to jail population by DOC through per diem, what percentage of the, I don't know if you have this, what percentage of the jail population paid by DOC is that compared to like the total population in county facilities? So is it 20% of all those in county jails are population paid by DOC? Is it 5%? Do you have an idea of what percentage that might be?
I don't.
I may have.
Randy?
Director, total capacity for jails, if you add them all up, is about 21,600 beds. We have, at a given time, somewhere in the neighborhood of 27 or 28,000. About 1,900 of those are the F6s that were diverted from prison and are sentenced to jails. Another 300 or so of those are people who either are parole violators who go to jail temporarily until we can bring them in and have a revocation hearing, or they're jail holds people who were sentenced and haven't come into DOC yet. If they're in the county jail 5 days after sentencing, we start paying the $35. So to put a figure on it, we're at about 12 to 13% of those that we pay $35 a day for make up about 12%, 13% of the capacity of the jail.
Okay, so a good percentage, but not an overwhelming percentage. The next question I have is on the community corrections, Commissioner, walk me through maybe the DOC does not direct those F6s to how they are placed in the county, if I'm correct. That is a decision made at the county level as to whether they're in community corrections, probation, or retained within the jail facility at the county. So it really isn't up to you or your office where those DOC population paid level 6s are housed. That really is the county that decides that. Is that a fair statement? I just want to make sure I understand the process.
Yes, it's judge and prosecutor. They make the decision on the sentencing. And we just fund the programs. You know, we fund the programs through grants. So well, that's all local decision.
Okay, and one final question, Mr. Chairman, then I'll be quiet. On the population change, moving upward there in 16, 17, 18, there was a law change that required that you keep level 6s that would have gone to the county a little bit longer, so they're serving a little bit longer sentence time within the state prisons than they would because of a change in terms of time served. So some of your population pressures, those people typically would be walking out the door, but now you're having to hold them a little bit longer in order to fulfill sentencing requirements and the length of stay. Is that a fair statement?
Fair statement. And there's some stacking. They're starting to stack now. The type of inmate that we're getting now is a little bit a higher level. The F6 are I don't know as far as danger is concerned, but they're the F6 inmates, the ones that are sentenced under the felony 6 are typically, you get theft and a reduced sentence or lesser included offense. But the ones that we're getting now, they're staying longer, and the type of facility that we need are more the higher level facility. So.
Okay. Thank you, Commissioner. Thank you, Mr. Chairman.
Senator Talley.
Thank you. Can you just explain to me on this, what's the county jail maintenance contingency fund as separate from the misdemeanor housing? What is?
I can explain it, but she can do it better.
The county jail contingency fund is the fund that we use for the felony level 6s. That's the $35 a day reimbursement. The misdemeanor fund is a payout that's done at the beginning of the year based on an old population census that just goes to the counties to take care of misdemeanors that had years ago been sentenced to the DOC.
Wait, I followed it all until you said years ago.
Brandy, do you know what? Yep, Brandy knows the year.
In the 90s, we used to receive misdemeanors in the Department of Correction. We were
Yes.
the only state in the country that still received. The law was changed
Yeah.
so that misdemeanors could no longer
Yes.
go to the department. When that happened, we created a formula so the counties could be reimbursed, and that was the misdemeanor formula that's still on the books today.
Oh, okay.
It's based on county population.
It's based on county inmate population
No,
or
county,
total
just
population?
county resident population.
Oh, okay, so it has nothing to do with the $35 a day. You're not paying to house misdemeanors. This is just a separate, and the fact that the other ones call a maintenance contingency fund, I should disregard that. Okay, thank you.
Senator Brown, you had your hand up.
Thanks, Mr. Chairman. You had mentioned in your transmittal letter the 10% vacancy rate is the national standard. What is your vacancy rate since you're hiring 12 full-time recruitment specialists?
Thank you, that's a great question. I think we're at around, I would say an average of the whole state in our 22 facilities, what is it, about 15 to 16%? Yeah.
And then these full-time positions you're hiring, this isn't outsourcing like some temp agency, employment agency. These are going to be full-time, permanent DOC employees. So if the rate goes down, they're still going to be,
Yeah, like we mentioned, I mean, we would like to have it at zero, but, you know, there's an acceptable spot, and that's pretty much an ACA standard, which is a Correctional Association, of 10%. So we try to find that, you know. We're working, we've got retention coordinators plus SPD, state personnel that are working daily trying to find ways to not only get people in the door, but to keep them. We have trouble keeping people. They'll get in the door and decide it's not what they want. It's just not for everybody, so it's
but
hard to-
these are recruitment specialists, not retention specialists.
Both.
Both,
We've got
okay.
both, yeah.
Thank you.
Representative Porter?
Thank you, Mr. Chairman. Thank you, Commissioner, for being here. One quick question to piggyback on Jason's comments. We see through your slide number 6, I believe, right now, we peaked out around 2012, around 28,000. Then we went down. Now we're back up at 26,740. That trend that we see because of the laws that we created, do you tell me we may have to have more beds in the future because of what we did legislatively for people to serve more time?
I don't know, you know, that House Bill 1006 was a 3-year process, and you know, I'm not going to blame anybody. I wasn't here during the time of the, you know, that the law was put into place and some of the information went back and forth. But typically, we would plan on, you know, an increase of what, 4% per year? So that's been our average. It did go down during this because a lot of these offenders that were going to be coming to us were diverted to county jails. So where we're going to end up, it looks like it's trending upward, but I can't, you know, it's hard for me. I hate predicting this stuff. I've got data folks that work for me full time. They are predicting that the trend is going to go up. Does that mean that we undergo a capital project? I don't know. But we will, you know, we're doing everything we can to try to find alternative ways of incarceration. And a lot of that's through, you know, not just community corrections, but we're trying to build our work release. I think work release, when I was sheriff a few years ago, I had a work release program. I think that is our future in this state, especially with some of our offenders that are less violent, non-sex offenders, is to build out work release facilities. And then get them trained up, get them certified, and let them work as they transition back out onto the, back out into the public. But I don't know, Representative, you know, what the future holds, but it does look like it's trending upwards.
Okay, thank you, Commissioner. Thank you, Mr. Chairman.
Senator Time.
Sorry, one more. So I'm looking at this slide, which is the jail population that you're paying. This is the F6? Mm-hmm. All right. So, but I'm looking at this, and there's a substantial increase, way more than the jail population numbers would show. So you're going from 17.8 million to 23.9, almost 24. What's accounting for that big of a change in your budget when this doesn't seem to show that?
She definitely can explain this better than I can.
Okay.
I'm going to pull out my calculator here just so I make sure that I'm giving you the right numbers, even though we've been through them about 1 million times. So the 17 million that we're currently appropriated, that gives us enough money to pay for a jail population, an F6 population of around 1,350 to 1,400 offenders. So last fiscal year, we paid out $24 million, much higher than what our appropriation was. So what you're seeing in our proposed budget are numbers to be able to maintain that $24 million payout that we're experiencing.
Oh, so.
It wasn't a true figure. I mean, it wasn't trued up.
Submitted actual, I mean, that doesn't really reflect that you were paying 24? Oh, transferred in? So the extra six, the number that says transferred in, like 6.3?
Correct, yep. So that's, we've found funding in other areas to be able to transfer in and be able to make those payments to the counties.
Okay, thank you.
Any other questions? All right, thanks, Rob. Next is Department of Child Services. Terry Stigdon.
Oh, that's helpful. Thank you. Oh, goodness gracious. Okay, is that better? Okay. I thought it was going to be tough because of my voice. It's helpful if I turn the mic on. Okay, just a quick review of the Department of Child Services. We updated our mission and vision statement this year to reflect that we are part of a larger system of child welfare and that we work with others in the community through provider partners and other agencies in order to protect children and help families in the child welfare system. This is a list of our values. I won't go through them one by one, but just to let you know that we added 2 values this year, one for prevention, for our focus on helping to prevent children and families from having to enter the system, but once they enter, preventing them from repeatedly experiencing abuse or neglect. And then continuous improvement, which is an intentional approach to improving quality of services and efficiency in processes. It's really a recognition that we need to be proactive and aware that the world changes around us, and we need to really be on top of those changes and ready to respond. Our goals for next year, we have 6 of them. 1 is to implement the CWG recommendation in alignment with our DCS goals. 2, to really empower and engage our workforce within the child welfare system. To execute our DCS goals in tandem with Family First Prevention Services Act to transform child welfare in Indiana. Information technology improvements for the Child Support Bureau, much needed improvements in newer technology and meeting federal program and security requirements. Strengthening our litigation training provided to our DCS attorneys, and enhancing and strengthening the foster care division. You should have a copy of the most recent stoplight report, a progress report from CWG. But I'm just going to highlight a few things that we've accomplished since the evaluation was completed and released in June of this year. In June, the governor allocated $25 million for us to use to implement the CWG recommendations. More than $22 million of that money went towards salary adjustments, and we were able to provide salary adjustments to 87% of our staff at DCS. Additional hires to help support the practice and the field with families. Improve leveraging of financial dollars with Medicaid, so we have a Medicaid expert that will be starting in mid-January. We added leadership development advisors to support the recommendation of improving development of our leaders, to support the work at the front line and improve the outcomes in the practice. And 3 provider relation advocates to work with our provider partners. We know that the best child welfare systems are those where supervisors do have the time to effectively and efficiently provide the coaching and support necessary to the family case managers in the field. So one of the recommendations that will take us some time is to improve the family case manager supervisor to FCM ratio. When the CWG was here to assess us, our ratio was 1 to about 7.34. As of today, or last week, we're at 1 to 5.99. We expected to be about 1 to 6.25 by this time of the year. We came up with that number to account for any attrition that occurs within the agency. And turnover has been improved, that we were able to get a little bit closer than we thought this time of year. The other reason it can't be a very, very quick transition is because we need to, there's a delicate balance between hiring supervisors and ensuring that we're not creating heavier caseloads for the family case managers through those promotions. Converting clerical administrative staff from contractors to state employees helps reduce turnover in those positions. They only last for so long, but it also helps us recognize the importance of frontline operations and the support provided by the clerical staff in the field. We just piloted our first regional delivery of cohort training to recognize that we had lots of staff traveling quite a distance and having to stay in Indianapolis because all of our cohorts were only in Indianapolis. We just started our first one in Knox County last week, and they have, I believe, 19 members in that class. Our second regional training will be in April 2019, and we'll have a location a little bit closer to that time. We're also seeking to decrease the cohort class sizes, and we're doing that by hiring 3 additional trainers. This will allow the classes to have 25 or fewer members in the class. This really allows for that interactive learning that is really necessary and best practice for new folks to the child welfare field. And decentralization. We started a decentralization committee in September of this year. It involves staff from the field, central office, as well as different departments. And they are tasked with providing a report to us on specifics around what we can decentralize, decisions that can be made at the local level that do not require central office input. This is a response to the intense micromanagement that was occurring, which resulted in delays in decisions being made affecting our children and families at the local level. Now an update for the hotline. Our reports to the hotline continue to be on the rise. Out of about 206,000 calls, we received 247,000 plus reports in state fiscal year 2018, which is a 24% increase since 2015. Despite the increase in calls, our hotline folks have done a great job of continuing to answer calls in a very timely manner. Excuse me. And for law enforcement that calls in, there's a quicker process for them to go through so that they can reach a hotline worker a lot quicker without having to go through all the questions, because we know that many times our calls are much more urgent. Our hotline workers average about 715 calls per normal business day and about 237 calls per weekend day. Our Child Support Bureau is in charge of administering Title 4D Child Support Program. It's state administered and county operated, so the county folks do not report up through the child support system. So we partner with each county, prosecutors, deputy prosecutors, the clerks, and the county folks to deliver child support to children. These are just a list of functions that child support provides: locating non-custodial parents, establishing paternity, enforcement, so that's working closely with the county prosecutors and deputy prosecutors, processing payments, dispersing, working with the ISET system, and medical support. About $1 billion in child support payments are processed annually, and we have about 1,200 state and county child support workers that work on child support. We have over 250,000 active 4D cases and 150,000 non-4D cases. So these are the private child support cases that our Child Support Bureau processes through its system. We're looking at a new system, Invest, to replace ISETs. It will, excuse me. It will have updated technology and will meet all of the federal program and security requirements for the system, and improved efficiency in the process, as well as increasing the child support collections, opportunities for collaborations, decreasing costs, and increasing federal incentive funds as well. The better we perform, the more we're rewarded by our federal partners. An update to staffing and caseloads. So as of November 30th, and the rest of the data you'll see will be as of November 30th. This is a snapshot to show how many caseload carrying family case managers we've had. And as you can see, we've increased by a little over 150 in the year. Family Case Manager Supervisor 4s are the supervisors that provide direct supervision to the family case managers. We've increased by a little over 70 of those in the prior year. And then as you can see in the next slide, you can see the supervisor to family case manager ratio that I talked about earlier. Now, this number is as of November 30th. The number I gave you earlier is as of last week. We did have a supervisor training last week to onboard new supervisors. And that's why our number today is 1 to 5.99. Focus on turnover, and this is where, when I talked about one of our 6 goals, engaging and empowering our workforce. We know that family case manager turnover has a negative impact on the children and families that we serve in several ways. Kids stay in foster care longer, the cases get delayed, there are disruptions in child placement, so they end up moving from one place to another, which is not good for the children. And there's a higher rate of repeat maltreatment and reentry into foster care. So we're using several recruitment and retention tools, enhancing supervisor training, also providing training to our local office directors, and expanding our scholars program with the IU School of Social Work. One important endeavor that we've achieved is working with SPD to improve the availability of the Employee Assistance Program for our staff. When I first came on earlier this year, in the first 4 months, I heard from them that they needed more. And so working with SPD, we increased from 3 to 8 free counseling sessions per issue for all state employees, so a benefit for all the state, but I appreciate getting that feedback from the DCS team to help make that happen. Also reducing family case manager caseloads. So when you're improving retention, you're improving the caseloads. Every time a case manager leaves, those cases have to be divvied up to the case managers left. So they're constantly trying to keep up. So the better we are at retaining our family case managers, the better the caseloads will be for all of the family case managers as a whole. Like I said before, we're working toward manageable supervised to family case manager ratios, and we're adding mentors to larger counties. And the mentors are those in-person, I would call them field educators and supports that ensure that the new family case managers for an extended period of time have the knowledge and support that they need to do their jobs. It's a very, very tough job, so we need to make sure they have support in the field. At the end of November of this year, we had 24,247 open cases. A little over 20,000 of them were considered child in need of services or CHINS cases. 3,400 informal adjustments and 829 collaborative care, which are our older youth cases. Just to give you an idea of the assessments, 10,197 new assessments were assigned in November, just November alone. Now, when I talk about open cases, that's one part of the process. So that is, after the assessment is finished, they've decided that a case needs to be opened. So there is a difference in when you're looking at staffing between assessments and an open case. It's not just a one and done number. Just a quick graph to show you cases as we've trended over time. And these are numbers as of November 30th in all of those years. As the caseloads have gone down, you can see that the assessments have gone up, continue to go up. As we look at our CHINS cases, we had 20,000, like I said, 20,015 open CHINS cases at the end of November 2018 this year. 75% of those children were placed in out-of-home care, and we have the breakdown here that shows you the comparison from 5 years ago. As you can see, our relative home placements have gone up. About 52% of the foster placements are in relatives, and the other 48% this year are in non-relative foster homes. As you may be aware, we use the 1217 standard to calculate our monthly caseload averages. 12 active cases, that's related to the assessment part, and 17 children related to the ongoing cases or the open cases. Our snapshot as far as, again, at the end of November, is we had 2,134 field positions, 220 currently in cohort training. So we have 221 family case managers currently in cohort. It's a 12-week process, at least about a 12-week process. It varies depending on how they're doing. Sometimes it needs to be extended a little bit, but they start every other week, so there's overlap. And we will continue staffing to make sure that we're meeting the needs of the local office and for the children and families that we serve. I'm going to hand it over to Leah, our CFO.
Thank you. So some of you may know that this past February, the Family First Prevention Services Act, FFPSA, was passed in Congress attached to one of the kind of budget resolutions. So we wanted to talk a little bit about that because it's going into effect during the next biennium. So this first slide that you'll see is meant to be a kind of a quick level set of the different, if I click the button, there you go. A quick level set of what that means. And so as a reminder, traditional 4E, traditional child welfare funding from the federal government was focused specifically post-removal. So you had to be in a licensed placement, a licensed foster family home, or a licensed residential facility, and you had to be an eligible child. Since 2012, Indiana's been under our cost allocation waiver, which gave us some additional flexibility that we've been taking advantage of. We use that to provide community-based wraparound services, as well as concrete services. Concrete services meaning the things that our families and children need, whether that's bedding, that's clothing. They might need an actual bed, for example, not just the bedding itself. So that allowed us to spend our waiver dollars on those types of services. When Family First passed in February, so it would go into effect next October 1 of 2019, the federal government now would allow 4E funding to be used not just post-removal, but also for what I'll call secondary prevention. Secondary meaning They have been identified as a candidate. They have been identified at risk of foster care, meaning at risk of removal, but they have not actually been removed. They are still with, whether it's their biological parents or whether it's with a kin. It could be a grandparent, aunt, uncle, and so forth. However, the money can be used in that environment only on evidence-based practices, these EBPs that you'll see on the chart. It has to have various degrees of data backing up that program, that service, actually has a higher chance of improving the livelihood of that child or family. So it does come with restrictions on that prevention money. Also, ACF restricted residential placements, meaning they will only pay for licensed residential placements if a third party has validated that need, as well that placement meets certain requirements. And I won't go through all of them. The list is pretty extensive, but you might hear things like, for example, they need to be able to have access to 24/7 nursing care. They need to be able to provide aftercare post-removal. I say all these things to help you understand that child welfare funding is making a dramatic shift in about a year from now. Now, because of that, since February, so going to the next slide, we in DCS, in collaboration with a lot of our partners, have been trying to understand what this means. What does this mean to Indiana? What does this mean to our kids and families? First, we realized that it's very closely tied with a lot of the goals and objectives that we want to achieve anyway. To Terry's earlier comments, we 100% agree that prevention is important, that we need to try to de-escalate the situation. We need to try to help our kids and families while they are still together intact as a family. And that is important first and foremost. We also need to use data to drive our decisions. If there's a service that has been rigorously studied that says if you do this in this situation, your chances of success are dramatically improved, let's do that. So we want to take advantage of a lot of the things in Family First. So that's what we mean on this slide by vision alignment, that this is not separate from CWG, this is not separate from our other goals. It all comes together and all aligns very tightly with the things that we want to achieve. So we've been going through a gap analysis with our partners, whether they be our providers, our court partners, to try to understand how far off are we from this vision that we want to achieve. And in doing that, we have a draft roadmap of some key items that we need to work on as a child welfare system. Again, this is not just a DCS thing. This is the system itself throughout the state of Indiana that we need to come together to work on. So for example, we, the state, will not be able to take advantage of the prevention dollars if we can't help our providers be successful providing evidence-based services. So as we did the gap analysis, we quickly identified that of our current, I'll say, service array that we provide in that arena, those community-based wraparound services, very few right now would be what considered evidence-based to our best guess of what that means. The federal government has yet to give us a holistic list of what they consider to be evidence-based, so we're using the best of our knowledge and understanding of what's currently out there to try to understand that. So that is a big gap currently with the child welfare system as a total. So as we look at what that initial implementation plan would be, we're still working through that, specific timelines and how to better engage and try to overcome some of these gaps. But because some of those gaps are so extensive, you may have seen that we signaled a delay to ACF. What that means, within the Family First legislation, jurisdictions are allowed to delay the implementation of Family First by up to 2 years. So instead of Family First going into effect October 1 of 2019, you can delay it up to 2, meaning it would go into effect October 1 of 2021. In November, we were required to give some indication to ACF where we were leaning. We are not held to that, but it's for their own planning purposes. Because of the gaps and the extent of those gaps that were identified, we initially signaled a 12-month delay. What that means is, kind of walk you through a little bit because there's a especially with the biennium that we're budgeting right now. What that means is for state 2020, we would have 3 months of our cost allocation waiver. That would then go away when the federal year starts. So October 1 of 2019, we would transition to traditional 4E funding, again, only for eligible placements, eligible kids, and the related administrative costs. And then October 1 of 2020, we would transition to Family First. That would be our current plan, and it's that mindset in which we built the budget that would be before you. So I wanted to make sure we kind of talked through some of that because it is a shift as we kind of go forward. So to our budget request. From a general fund position, state fiscal 2018, we received a total of $956, almost $957 million of general fund. That includes all sources, the appropriation plus the augmentation that we received. That also includes the $25 million that Terry mentioned as part of that calculation. Because of how the base was calculated, that therefore rolled into it. And then the only change package that we are requesting is the $8.58 million related to pay for performance and benefit increases that have already occurred. So with that, I think we take questions.
Questions? Senator Brown.
Thank you. I guess I'm a little bit concerned that we have one of the highest rates, if I'm correct, of removals in the country. Is that correct still?
Based on the information from CWG this summer, yes.
Yes. And so, and that's costly for everyone. I mean, the child, the family, I mean, obviously. And then there are financial costs with that, obviously.
Correct.
And so your budget, and you're doing training, which is great, because you had a high turnover in 2017 at 30%. And I assume because of that, you've enacted an employee assistance program where they can have 3 free therapy sessions, and now going forward, all employees will have access to 8 sessions, including their whole household. So I imagine the stress of the job is significant, and so part of that will be to cut down the turnover and have better employees. But with all of that, my concern is we have such a high rate of removal. And we'd had some concerns with some of the performance. There's going to be training for the attorneys as well, which I don't think we really discussed in detail. But your base is contemplating that, in a sense, nothing will change. I know some of the ramp-up has been directly a result of the opioid crisis, but my concern is that the mode of operation, if you will stay the same.
So, looking at the CWG report, they were looking at past data, current up until that time. Our removals are down. They are using a more evidence-based approach for their assessments. And so the initial response to just remove quickly to be safe, so to speak, that is not the same today. So if you look at our caseloads, they're going down. Assessments are up, but assessments don't equate to removals. The practice has changed, and the support has also improved with the supervisor to family case manager ratio. So looking at how we transition, especially with and being mindful of Family First Prevention Services Act, knowing that that's one of our goals is to be absolutely aligned with Family First and provide the least restrictive level of care for kids. We anticipate to continue moving in the direction we're moving now as far as open cases.
And then with that, I've had conversations, I know some of my other legislators, with respect to concerns about, in the past, and it is in the past, some of the family case managers and how one who gets into the system is able to report their concerns, complaints, and criticisms. Have those processes been implemented?
We are starting the work for a safety culture. We're actually working with Casey Family Programs and changing from the, what people heard about a lot, the culture of fear, moving toward a safe culture where our family case managers can report if they have concerns without fear of any type of punishment or retaliation. So that we actually begin that work. I believe our first survey is going out in January to do an initial assessment. We're partnering with other jurisdictions around the country to create a safety culture. All child welfare agencies recognize that it's an issue, so we'll be partnering with other child welfare agencies and learning from each other and implementing processes to provide for safe reporting.
I'm not sure that's, I didn't mean I meant reporting about the case manager
Oh, I'm
and the
sorry.
process. There have been criticisms, complaints about them, and there didn't seem to be a process before. I appreciate that there are concerns about safe reporting too, but is that being implemented as well with this change?
That's all a part of leadership development. So yes, that is included in developing our supervisors and our local office directors as well.
Thank you. Do I get this right, that you're only asking for an additional 8.5 million total, your total budget? And it says on the back, reflecting P4P and benefit increases that have occurred. What does that mean?
Those are pay for performance and benefit increases that the state in general provides, and those are those that have already been done in 17 and 18. So we were allowed, as part of budget instructions, to request a change package to align with those increases that have already occurred.
Okay, what about, are we doing anything to encourage additional foster parents? I mean, we have a shortage and they're not getting enough money. Are we doing anything to get them some more money?
So if you look back at our goals, number 6 was our improving our foster care in general. We are going to look at all of that. Our first step was getting a leader for that division. So pulling all of our folks that work with foster care, instead of having them report to different folks throughout the state, they'll report up through one person. And that person, along with her team, will look at everything that we can do to help with retaining foster parents. So,
Well, but I thought it was pretty clear, and maybe I'm wrong, but I thought it was pretty clear that A, we have a shortage, and B, they're not getting enough money. Are you doing anything to ask for more money to pay? Yeah, what's the per diem?
I can get you our chart, our matrix, because it depends on the needs of the child as well
Yeah.
as the age. So we can send you that matrix that would spells out our current foster care per diems.
All right, but my question is, is there anything in this budget to add more money to that?
Our budget assumes current foster care per diems.
Okay, all right, thank you.
Thank you, Mr. Chairman. Thank you, Director, for being here. I want to follow up on a couple of questions that was asked. So, $25 million was given to the agency a while back, which was non-legislative appointed dollars, right? And then you took $22 million, according to slide number 7, went towards salary and adjustments. Now, if that went towards salary and adjustments at $22 million, and you're only asking for 8.58, is there a gap there, or I'm not on the right page?
So the 858 is for P4P and benefits that already occurred before we did any adjustment for CWG.
Okay, so, but if you got a shot in the arm of 22 million, 25 million, 22 million went towards salaries, how is that going to be sustainable in the future? I mean, you got that, but you're only asking for pay for performance, $8 million. So to me, there's a gap, right, or not?
So I think I believe the P for P is a decision that's made every year, whether or not that will be provided. So we only included the P for P that has already occurred. We did not assume anything that may or may not occur in the future on the P for P for calendar year 2019 or 2020.
So the raises don't continue? It's not
The
sustainable?
raises are built in because the 25 is built in.
Okay. Follow up again, all right.
Yeah.
So raises are there. What about your, I have a question. What about your providers? Are there any dollars for the, to increase the rate of the providers in your budget?
So we used our current rate structure to build our budget. So the rates for,
So low, right? I mean, have the rates increased for the providers recently?
so we have different providers, and they have different rate calculations. Residential and LCPA, as well as the foster care per diems,
Right.
are reviewed every year.
So have those increased? I mean,
It depends. So residential and LCPA rates are based upon their costs. So depending on what they are seeing, they may fluctuate accordingly. We
It
get-
de-
go ahead.
Okay, so therefore, it depends on how it fluctuates, right? In
On how
regards to
their own costs fluctuate.
their own cost fluctuates.
Correct.
Okay, well, I'll see you in about another 6 weeks anyway. I have more questions.
All right.
One of my biggest concerns for this budget cycle is the increase in the DCS spending. And I'm hearing that salaries are too low. I'm hearing providers say that the reimbursement rates are too low. Yet your expenses are almost 600 million more than what we appropriated over the biennium. So I guess I'm confused if you overspent by $600 million and you didn't use it for salaries, and what did we use it for?
So looking at, I'll talk about 17 to 18. So when I mentioned our cost allocation waiver, it was identified that we had overspent that waiver in prior years. So through the course of state fiscal 18, we had to make that shift from a funding position, meaning we had to shift those expenses to more general fund dollars than we had in those prior years. So what that meant was that we could continue and maintain the service level at where it previously occurred. As we go forward, we still are not going to go back to the federal levels that we were previously because we had overextinguished it, and we're trying not to make those same mistakes again. So we're trying to level set our funding streams to take advantage of federal dollars when we can, but not too much where we get put in the same situation.
Thank you, Mr. Chairman. Just to clarify the numbers and to provide some history and context, number one, in 2017 at the end, the governor requested a $25 million augmentation, which is authorized by state law, so it is allowable, in fiscal year 17 to address pay for family case managers as well as some other pay issues. That money was provided in 17, but actually spent in 2018. In addition, as the CFO has mentioned, as federal funding from the waiver was extinguished earlier than expected, funds needed to be identified to maintain level of service to children as well as the staffing costs. So that's why you see on your agency operating account summary, the submitted actual fiscal year 18 for the total general fund is $956 million. That was the actual spend, which includes the $25 million. As I mentioned in my opening comments, the base that we started every state agency at was based on 2018 spending, which is over there in your column noted as submitted base. So that is a reflective of what the department spent in total out of the general fund in 2018 and where we started DCS. So I want to be very clear that we're showing on this document the actual spending and the starting point of what DCS needs. So that $956 million includes the pay adjustments, not only for family case managers, but hiring as well as the attorneys that we discussed at our hearing many months ago regarding the attorneys and adjusting their pay as well as bringing more attorneys on. The $8 million is the 3.3% pay adjustment for all employees in every department that you've heard about throughout these last 3 meetings that we asked agencies to include in their budget. So that $8 million and change is to fund performance pay increases that have occurred in 17 and 18 and health insurance increases in 17 and 18 to help state agencies maintain their funding for staff going into into 20 and 21. So I want to be clear on that page 3. It's pretty clear in terms of what the spending level was and then the additional funds being asked for as part of the department's request for that 3.3% we discussed back on December 3rd. Thank you, Mr. Chairman.
Next up, we have the Commission to Combat Drug Abuse, Jim McClellan. I'll tell you what, here's what we're going to do. Since we're a half hour ahead, Mr. McClellan's not here. Are you ready? So we'll move to the Tobacco Master Settlement Fund review with Joe Habig, and then we'll come back when Jim gets here. Is that all right with everybody? Mr. Houston, is that okay?
All right, thank you, Mr. Chairman, members of the Budget Committee. Thank you for having me today. My goal with this presentation is really just to give you all, as we enter a budget session, just some background and context on the Tobacco Master Settlement Fund. So outside of general fund, the Tobacco Master Settlement Fund is our largest state source of funding for health and human service appropriations in Indiana. Okay, so some history. Back in November 1998, there were 46 states with their attorneys general who signed the nation's largest tobacco agreement with some of the largest tobacco companies at that time. What the agreement called for was that there were going to be annual payments made by these cigarette companies in perpetuity as reimbursement for some of the state's cost for past tobacco-related healthcare cost. The agreement imposes no restrictions on how the state spends the master settlement agreement payments. The state of Indiana has full flexibility in how we use that. And right now, our allocable share, and it's been this way since the 1998 agreement, is 2.038, and there's some more decimal points on that, but we'll just round to 2.039% of the total annual payments to states. In 1999, the General Assembly created the Tobacco Master Settlement Fund to receive these payments and to make appropriations out of. So in 2013, as part of an arbitration ruling for the 2003 sales year, Indiana actually received a large reduction in our payment in the FY14 payment, $63 million. At that time, luckily, the Tobacco Master Settlement Fund had a balance over $85 million. And so we did end up using a little over $57 million of that reserve balance at the time in FY14 to cover that revenue shortfall. And then in 2014, and then it was finalized in 2017, Indiana joined a settlement that would prevent similar arbitration decisions for sales years 2004 through 2017. So revenue projections and receipts. The revenue projections we have are based on several assumptions made by the NAAG, and there are adjustments. So there's a $9 billion payment baseline that these tobacco companies who are part of the Master Settlement Agreement have to make. On that baseline $9 billion, there are several adjustments made to it. So we don't actually receive 2% of $9 billion. It's something far less. First of all, there's just a volume adjustment. As cigarette sales have declined since 1998, there are adjustments down on that $9 billion payment. On top of that, there's a corresponding increasing adjustment for inflation, and the Master Settlement Agreement sets that at 3%. That's the floor. It can be higher. It's typically been at that 3% for years. And then also there's an adjustment down on the payment for some states that settled previous to the Master Settlement Agreement, those states like Florida and Texas and Minnesota. And then also there's another adjustment based on the market share loss for the participating manufacturers compared to non-participating manufacturers in the settlement agreement. That NPM adjustment it's not really a 13% loss in market share. It's actually that 13% represents 3 times the market share loss that the participating manufacturers are losing to non-participating manufacturers. So the actual revenues for the given year are not known until after April 15th. April 15th is the date set in the MSA when tobacco companies have to pay those annual payments. So with that being said, we'll go 3/4 of the year of our fiscal year before we really know how much we're going to receive in a given fiscal year. So this graph will show you a little bit of the history of revenue since 2012. You'll see the anomaly year in 2014. I mentioned that earlier. That was due to the 2013 arbitration ruling. Some of the revenue that we received in 2015, because it does look quite a bit higher, was really a timing delay. It should have been received in 14. It was for the 14 payment, but we received it in fiscal year 15. So actual fiscal year end fund balances. In 2015, we had a little over 50 million. That dropped a little in 16, but it's steadily climbed the last couple years. Right now, we're expecting we should have over 80 million at the end of FY19, assuming we spend all of our appropriations. So how's it used? You may have seen some of this from Health Department's presentation and FSSA's presentation, but Health Department and FSSA are the 2 largest recipients of appropriations from the Tobacco Master Settlement Fund. 63 million of it does get appropriated to Health Department in the current biennium, and that goes for various different programs, including efforts to reduce infant mortality rates, tobacco use prevention and cessation, which we talked about earlier, community health centers, local health department funding comes from the Tobacco Master Settlement Fund. There are some minority health initiatives. Deaf and hard of hearing services receive this. There are appropriations for HIV, AIDS, and also children with special health care needs receives over $10 million from this fund. For FSSA, the appropriations total over $47 million, and those go to really funding for community mental health centers. They go to fund our adult protective services appropriation. They do fund a burial appropriation to cover funeral and burial services for Medicaid recipients. And they are the Tobacco Master Settlement Fund is the source of funding for our state share of CHIP. $7 million gets appropriated to some primary care scholarships and medical residency grants. And then also we use $12 million of it a year for annual lease payments to IFA for 3 state psychiatric hospitals. So I do want to highlight some future funding challenges that the Tobacco Master Settlement Fund is going to experience. One, in talking with the Attorney General's office, there is a concern that as sales decline and participating manufacturers to the Master Settlement Agreement start to lose a greater market share to non-participating manufacturers, that this is going to be a declining revenue source. We already have a situation where the adjustment for volume is overtaking our 3% floor on inflation. So this will be declining in the future. On top of that, this has been our historical source of funding, the state share for CHIP, and beginning in federal fiscal year 2016, the Affordable Care Act actually increased our CHIP FMAP, so the portion that the feds are going to cover, over 99%. And for 2 biennia, we had a very high level of federal funding for CHIP, which meant that our state share obligations were around $1.5 million. That is changing with the recent legislation with Congress. It is actually going to come back down to those historical levels of more 76% federally funded. They're going to stair step it, and I've put the FMAPs on here so you can kind of see how the federal share is going to be dropping over the next biennium. So that's going to create a challenge on how to fund the state share of CHIP. And that is all I have pending your questions.
Any questions for Joe?
All right. Thank you.
Mr. McClellan, we were ahead of the schedule, so since he was here, we went ahead and did the master settlement. So you will be next. Maybe I can make it.
Work to end the drug crisis in Indiana. As you know, it's a crisis that affects people of all ages and socioeconomic levels and touches every part of our state. The economic costs of this epidemic are staggering, but those pale in comparison to the toll on human lives. As you know, attacking the opioid crisis has been one of Governor Holcomb's top priorities since day one of his administration, when he also called for an all-hands-on-deck response. We're taking a strategic approach to the challenge. We're coordinating, aligning, focusing the relevant resources of all the state agencies that affect this issue and related issues to maximize impact with the resources available to us. And as we go about our work, we have 2 overarching goals. One is to help as many people as possible who have a substance use disorder achieve and maintain recovery so they can become or return to being productive, contributing members of their communities. And at the same time, to take steps to substantially reduce the likelihood that we will ever again be faced with a crisis of this magnitude arising from the use of any addictive substance. We have terrific cooperation across the various state agencies that are most connected with these issues. We're also working with a growing number of strong, broad-based, cross-sector coalitions where people are coming together at a local level with a focus on prevention, treatment, and recovery. They're working together, they're learning together, they're finding ways to use their respective skills and other resources together to increase their impact in their communities and make more effective use of their collective resources. Now, we've done quite a lot during the last 2 years, and we're providing you with a hard copy of a list of accomplishments that can also be found on the Next Level Recovery website. But I'll take a few minutes to highlight some of what's been done. We've put a very high priority on increasing timely access to treatment and creating a treatment infrastructure that can adapt to be effective with people across a broad range of substance use disorders. During the first half of this year, we opened 5 new opioid treatment facilities that were possible under a previous statute, and thanks to legislation passed during the last session and signed into law,
we're now going to be able to open 9 more. Those are going to be, that's going to be done just as quickly as we possibly can, and they'll be placed strategically so that nearly everyone in the state will be no more than a 1 hour's drive away from comprehensive services that can include any of the 3 drugs approved by the FDA for treatment of an opioid use disorder. In addition to those opioid treatment programs, DMHA has certified since January 17 an additional 44 addiction treatment providers, bringing the total to 253 certified providers who have 428 locations around the state. We've also increased the total number of treatment beds to over 1,000 and linked the modified open bed software platform with a statewide 211 system to enable quick and easy identification of an available treatment bed anywhere in the state. This not only helps get people into treatment more quickly, but it also helps make more complete use of statewide capacity. We sought and secured a Medicaid waiver that now enables us to use Medicaid and HIP dollars to pay for a comprehensive array of services. 1.6 million Hoosiers are Medicaid eligible. Since the waiver became effective in February, over 38,000 individuals have accessed the new benefit. To reduce the number of excess pain pills that could be diverted for non-medical use, we continue to emphasize reducing opioid prescription rates and increasing the ease with which people can safely dispose of their excess pills. Indiana State Police and the Board of Pharmacy at the Indiana Professional Licensing Agency, in partnership with the Federal Drug Enforcement Agency's National Drug Take-Back Day, collected over 10 tons of unused medications during a 2-day statewide event in October, bringing the total collected since January 2017 to was actually over 27 tons of pills. I have a hard time imagining what that must look like. In addition, we have supported programs made possible through legislation passed in 2017 as follows. We provided support under Senate Enrolled Act 243 for a program and protocol for OBGYN doctors to be trained in prescribing drugs for medication-assisted treatment, and provided resources for treatment and recovery of expectant mothers who were using opioids and subsequently their newborn children. We've also supported Volunteers of America under Senate Enrolled Act 446 to provide opioid treatment and recovery services for expectant mothers and mothers of newborns at 3 locations, Indianapolis, Winchester, and Columbus. VOA will add a 4th site in Evansville during the first quarter of next year. We've provided or reserved support for a 3-year involuntary opioid treatment pilot program in Tippecanoe, Marion, and Wayne counties under Senate Enrolled Act 499, and we're also providing support for a jail diversion project in Allen County to provide residential and outpatient substance use disorder treatment under Senate Enrolled Act 510. On the prevention front, we're providing support to help young people in high-needs areas of the state avoid developing substance use disorders. We're doing this through Youth First, an Evansville-based organization, and City Connects, which is a program operated by Marion University where they are placing counselors in schools to augment the school staff. And Purdue Extension is operating the Strengthening Families program, which has a lot of evidence of significant long-term impact. We're providing some support to enable them to do that in an increasing number of counties. All of these programs not only help prevent young people from developing substance use disorders, but they also provide additional societal benefits. It's important to emphasize that we're working in numerous ways with entities in other sectors, including several private foundations, and we're utilizing the federal 21st Century Cures Act grant and the federal state opioid response grant to maximize what can be accomplished with the total resources available to us. And we're excited about the relationships we have with several strong community-based coalitions and recovery-oriented systems of care around the state. Some great examples are in Clark, Bartholomew, Howard, and Dearborn counties. Such groups can be particularly effective in connecting individuals and families with services they need, in helping prevent substance abuse among young people, and in supporting people in recovery. As we look at the data and the responses that are likely to have the greatest impact, we know that adaptability is an important asset. And while we're fortunate to have more federal money than we expected 2 years ago, those dollars do have restrictions. It's vital that we continue to have flexible funds to supplement other sources, fill gaps, build capacity, and address unanticipated needs and opportunities. Important uses for such funds include support for development and capacity building of local cross-sector coalitions focused on substance abuse prevention, treatment, and recovery. Our support will go to groups with strong local leadership, active partners, and strong potential for getting results. Examples of purposes for which funds may be used by local coalitions: navigators, who serve as a primary point of contact and case manager, connect individuals and families with needed services, and provide continuity of a relationship. Wraparound services for people awaiting admission to a treatment program. Support such as transportation to and from treatment for people actively engaged in a treatment program. Extended wraparound services for people in recovery, and the launch or expansion of evidence-based prevention programs for children and youth. Other areas where expansion of our efforts can be particularly effective include the following: payment for recovery housing for people with no other payment source, including people who have issues with drugs other than opioids. A version of Recovery Works for misdemeanors. Jail-based treatment, which is part of the governor's 2019 agenda. Re-entry services such as connection to treatment in the community and wraparound services to help find housing and employment. And more recovery support services, including recovery housing, which is also part of the governor's 2019 agenda. More school-based substance abuse prevention programs, and more family recovery courts, which work with families involved in CHINS proceedings involving substance use disorders to improve treatment completion and family reunification rates and decrease out-of-home placement costs. And assisting with the addition of more family recovery courts is also part of the governor's 2019 agenda. In closing, we are seeing some encouraging signs that reassure us we're on the right track, but we also know we still have a long way to go. Yet when we see signs of progress, that's when we really need to redouble our efforts, pick up the pace wherever we can, and continue to build positive momentum. And as we do this, I'm confident we're going to end this crisis, and we're going to do so in far less time than it took to create it. Thank you again for the opportunity to talk with you this afternoon and for your partnership in this work. I'll be happy to answer any questions you might have.
Any questions? Senator Towns?
Yes.
Thank you. I'm sorry, but I'm not following the budget summary here. So, stop. So you've got listed in this
Yes.
about $8.5 million
Correct.
worth of, but you've got listed in your budget summary that you've got $4.8 million. I mean, what? And then you started talking about some federal money that might be available, and it just doesn't look like all the numbers are on the sheet.
No, not all of those would be on this sheet. The money here is of the $5 million that was made available to our office, governor's office, for this purpose during the 2017
Yes.
session. And that's $5 million a year for this biennium. We basically have used now through three-fourths of that biennium, we've used about almost $8.6 million of that $10 million. That's what we've used. The additional monies that I referred to, we are receiving $10.9 million from a grant from the 21st Century Cures Act. That's a state-targeted response grant.
That's from the feds.
That's correct.
10.9.
That's federal money. We are now in the second year of 2 years of that grant, $10.9 million per year. In addition to that, we're receiving through the new state opioid response grant, which is also federal, $18.1 million this year, and next year we'll receive another $18.1 million. Those dollars do have some restrictions on them, but we're going to make good use of those dollars as we implement some of what I've just announced as part of the governor's 2019 agenda.
Okay, so just saying, this really needs to be updated to show all those, to show the extra money that's come in from other places, right?
May I ask a question? Because I don't know exactly where those numbers come from. That's not something that what we do is we make that money that we have available to our office available, and we basically, for example, the $1.5 million that was reserved for implementation of Senate Enrolled Act 510 in Allen County. That money was transferred over to DMHA. It's there for no other purpose, but that's in DMHA now, and it's up to, it's being used as invoices are made available to DMHA from the folks in Allen County.
Okay, so what we've got on here just does not show everything that you're doing.
No, it
Now-
would not show the federal
So
money.
my second question is, do you have any follow-up data as part of these programs that are listed on here to show, for example, $1 million into family recovery courts, what are they doing? How well are they doing? Is it worth pursuing? Are they making any efforts?
The
Do we
family
have-
recovery courts.
Well, not just that one, but all of
Right.
them. Do
Well,
we
in the
have-
family recovery courts, that's money that we'll be using in the coming year, in 2019. It's to help. Right now, we have 7 family recovery courts in the state. That's all we have. They're all at capacity. Only 2 are receiving any federal money at all. The Chief Justice and DCS are really wanting to expand to 26 of those statewide. There are 9 communities right now that are ready to go if money is available. They want to initiate these. So basically, we could use the $1 million of the money from our office next year and the following year, and basically we could come pretty close to doubling the number of family recovery courts that we currently have. So that's something that is yet to be done. But the family courts themselves are highly effective at increasing completion rates, increasing family reunification rates, and decreasing out-of-home placement costs. The Senate Enrolled Act 243, that pilot, I'm sorry, that's not a pilot program, but the program for medication-assisted treatment for expectant mothers and subsequently their newborn children, that is underway. It's being implemented by Community Health Network. And Volunteers of America now has locations operating in Indianapolis and Winchester. They're full. They're at capacity. They're getting some good results. I don't have the data with me right now, but they're getting. I was talking with with John Van Arks, who is the CEO of VOA last week, and they're really seeing some very encouraging results with the individuals that they have in their program. There's a lot of demand for this, and reducing the incidence of neonatal abstinence syndrome, which is just it's a devastating thing, is certainly going to also help decrease our very high infant mortality rate in the state.
Well, yeah, and I ask these questions because I'm looking at the $8 million that you
Yes.
have, plus an additional 20 or something from the feds, or 30, and reading at the same time that 2017 was a record number of opioid deaths.
2017 was. We began our work at the beginning of 2017. A lot of what we put in place or initiated in 2017 we started seeing effects of that toward the end of 2017, and we're seeing it in 2018. We're seeing some very encouraging signs right now. A lot of the data are still preliminary; they're provisional, but we're seeing some positive signs. And I'm getting reports from some of the county health officers. I got one last night from Clark County, for example. And they're very excited about some of the results that they're seeing. And this is true in a number of places around the state. But again, I don't want to quote numbers, simply because they're still very preliminary, and we want to be sure of the data that we're reporting before we make them public.
Thank you.
Thank you.
Next, we have the Finance Authority, Dan Hughey.
Ready when you guys are, sir, Senator? Allowed me to catch my breath from the walk over. I'm ready to go. Appreciate your time today to walk through the IFA's debt overview. Try to do it in a similar fashion we've done in years past. Next slide kind of just walks through what we're going to try to accomplish here. We're going to go through the debt management overview of the Indiana Finance Authority and its creation, the public finance director's role, and a history of the state's credit rating. And then we'll go through the appropriation-backed or supported debt, and then non-appropriation-backed debt. We'll also go through and then the level of oversight we provide to both. This may be a repeat for a lot of you here, but there are a couple new members. I wanted to make sure I walk through the history of the IFA. It was created in 2005 by the General Assembly. Created the IFA to oversee state-related debt. The enabling legislation actually consolidated 5 previously separate entities into the IFA. As shown below on the graph, you had the Indiana Transportation Finance Authority, which handled most of your INDOT-related debt, State Office Building Commission, which would be your state office buildings, north, south, parking garages, et cetera, and probably State Museum, et cetera. Indiana Recreation Development Commission, which would be the state park properties. State Revolving Fund, which is our EPA partnered program for clean water and clean sewer, and the Indiana Development Finance Authority for special economic development transactions. And then I think after '05 and '07, we also rolled the Indiana Health and Educational Facility Finance Authority into the IFA. So what that did is it rolled 6 different entities that were issuing debt on behalf of the state of Indiana, all having a different voice to the market, to the rating agencies, and putting them under one roof so there was one voice to the market, one coordinated effort to reach out to the rating agencies and the buyers of the state of Indiana's bonds. The IFA issues debt on behalf of these 6 predecessors and has managed their debt in their portfolio since '05. We also issued debt for special projects, Stadium Convention Center, the Lucas Oil Stadium bonds, the Indiana State Fair Coliseum project, Indianapolis Motor Speedway, are a couple of special bond issues we've done over the years. During the '05 assembly, the finance director was given statutory oversight of all debt issuance as the chief executive of the Indiana Finance Authority. Pursuant to this authorization and executive order, the public finance director has the following additional responsibilities. The public finance director is a board member for the Indiana Bond Bank and the Indiana Housing and Community Development Authority. We are involved in the approval process and review process for any public university debt. We also are involved in all debt issuances for the State Fair Commission, the Ports of Indiana, and the Indiana Secondary Market for Educational Loans. I think they've changed their name to InvestEd at this point in time, but statutorily they're still Indiana Secondary Market for Educational Loans. The ability of the public finance director to monitor all debt being issued by state issuers enables consistent debt management across the state, as I'd mentioned earlier, one voice versus many. The other important one is also the public finance director is responsible for communication with the rating agencies related to state's credit rating. I can tell you we've had phone calls in the last 60 days with all 3 rating agencies, giving them an update of our fiscal health, both from a budget standpoint, our debt overview, and our pension obligations. And again, I think those presentations were well received and not a lot of questions. They view us as having a really good partnership with all 3 of those rating agencies, which is something we've strived to do over the years. So, next slide goes through where we currently stand on our credit ratings, and we are one of, and ask Mark Pasquarello, debt director, we're one of 11 or 12? 12. We're one of 12 states with a AAA rating by all 3 rating agencies. There is a 4th rating agency that's coming on board called Kroll Ratings. We have not approached them so we could be a quadruple AAA. That has not been discussed yet. You'll see where we started a few years ago at a AA positive to a AA plus with some of these rating agencies, and over the years have gotten ourselves up with each one of them to AAA status. This reflection of AAA status kind of reflects the solid level of our reserves. It shows financial stability. We show an active budget management process, demonstrated willingness to restrain spending during a revenue downturn, low overall debt levels, the economic base that is almost fully recovered from the impact of the Great Recession. And I know they'll be looking with the balanced budget amendment that was just passed. That will be another one that actually will strengthen our credit while we're doing it. To see it in our actual Constitution is another credit positive for the state of Indiana as they go through our review process. So that was a good pickup for us this last election cycle. real briefly, Moody's each year actually issues a debt median report, which I did not bring a copy of. It's a pretty long report. But to give you an idea where Indiana ranks amongst the 50 states, they rank each state on debt per capita or debt per person. We currently have $295 of debt per person in the state of Indiana. The lowest ranking, or the best ranking, is 50. We are 45th. So we're in that lower quadrant of the lower 5. To give you comps for other states around us on their debt per capita, and I'll have a handout to send your fiscals. I just kind of put this together. It's not in the presentation. Michigan is 33rd. Kentucky at 13th, and remember, the lower the number, the higher the burden. Wisconsin 15th, Ohio 23rd, and Illinois 6th overall. So as we look at our comps to other Midwestern states, I think we find ourselves reflecting that prudent fiscal management we've been trying to do over the years. I'll make sure this gets sent out to your fiscals and the state budget agency along with a copy of that median report. I'm glad to forward that on. Going to walk through our appropriation back debt now and kind of try to walk through it in a summary format at the beginning and then detailed by these different silos. So the Transportation Finance Authority currently has $933 million of debt outstanding. I did a little research before we came over here. That is, each year that goes down by about $65 million in principal. Each year that's dropping. We have the public university fee replacement bonds, which total about $1 billion amongst our 6 or 7 state-supported universities. There's an appropriation that backs these, but it's actually the student fees that are the main revenue source to repay these initially. But there is an appropriation in there, and the rating agencies do look at that when they review the public university debt. So that's one of the reasons we keep an eye on it also. The Stadium Convention Center bonds outstanding right now are about $1 billion. Now, the nice part about that one, I'll hit it on again on the other side, is this is not viewed as direct debt of the state of Indiana because we have the hospitality taxes that are fully self-supporting the debt service on these bonds. So all the hotel motel tax, the food and beverage tax, the auto rental tax, all those things are coming in well above what the debt service payment is each year. So a number of years ago, the first 2 rating agencies took that off of our debt burden, and Moody's was a little late to the game. I think about a year and a half ago, Moody's finally looked at it again and said they changed their decision tree and actually removed this also off of our portfolio, which to us was a big win to get $1 billion taken off of our debt burden as the rating agencies look at what we currently have appropriation supported. The Indiana State Fair bond issue is approximately $49 million. That was for the renovation of the Coliseum. That bond issue was originally about $62 million. The State Fair actually paid down almost $7 million last year via a call provision we put in the bonds, and that was a recommendation when these bonds were issued that they strive to accumulate other funds to pay a portion of these bonds down early, which they did. State Office Building Commission has about 310 bonds outstanding. Those are direct appropriation backed. The Indiana Bond Bank is a separate entity, but they do have the authority to issue what they call moral obligation bonds. I'll go into a little more detail on a slide further on, but moral obligation means the first line of revenue for these bonds is the local revenues. As long as those come in and they pay the bonds, it's great, but if there is an incident where the local revenues do not come in, there is a moral obligation, meaning that we would come to the legislators and ask them to actually appropriate to make a debt service payment on these bonds and get a debt service reserve account refilled. Since 1984, they've not had a call on the moral obligation debt at the bond bank. I always like, making sure everybody understands that part also. Very small amount left outstanding at the State Park Inns Recreational Development Commission, about $15 million. Indianapolis Motor Speedway, which is for about $93 million of improvements we put in out there back in 05, 06 for the 100th running. Those do have an appropriation backing them, but we do have a rental payment from the track that covers debt service on that, along with a special qualified motorsports investment district that is capturing sales tax and income tax in a district that surrounds the track and other key areas around the track, which I think we just got expanded last year to include a few more areas. And the last one is we put a little abbreviation there, but it's basically the East End Crossing Bridge, or the Ohio Bridge project, which is down in Jeffersonville, Louisville. There was a special loan through the Transportation Innovative Finance Act at the federal level that gave us a subsidized rate on a portion of the debt service on this, and that one is just related to ORB, and that one is, I think, outstanding for 20 years, and we're making payments on that annually. touch real quick on, the appropriation-backed debt is approved by the General Assembly, so it has to flow through, you all first, and then it's either by approval of the project or via source of funds used to finance the repayment of the bonds. The IFA cannot go out and do a bond issue without having that approval from you all and then coming back to the Budget Committee for a second level of approval or review. Again, the issue where we have direct oversight versus indirect. Transportation Finance Authority is direct oversight. It flows through the IFA. Public universities, we do review each year, sit down with them and review their debt. We work with Budget Committee and the Budget Agency when they're bringing up a new bond issue to review that with them. This year was the first time we actually had all the public university debt managers or VPs of finance actually come into the IFA and have kind of a get-together, all 6 or 7 of them, to discuss what was going on in their world, kind of compare notes on how they're interacting with the market, the rating agencies, and even give a little bit of education for them. And I think they've asked to do that again. Is that correct, Mark? So that was a good success to partner with them on that. State Office Building Commission, that's now part of the IFA, so we have direct oversight. Indiana Bond Bank, we are a board member over there, but that anytime the Indiana Bond Bank wants to issue moral obligation debt, it requires a review of the Budget Committee. And then the Recreational Development Commission is also part of the Indiana Finance Authority. Mentioned we go into a little more detail on the debt that's outstanding. First one's the Indiana Transportation Authority. We issue debt in partnership with NDOT to finance the cost of construction, reconstruction, acquisition, improvement, or extension of the state's public highways. However, no new highway revenue debt has been issued since 2004, and there's actually been a moratorium on highway revenue bonds since 2007. That has not been lifted. So the state of Indiana right now does not have the authority to issue highway revenue bonds. And there's another financing option called GARVIs, which are kind of leveraging your Fed funds and issuing debt against those. I believe that sunset, if I remember right, in 2009. So we have done a very good job of managing this portfolio, and that's why every year it's going down by about $65 million, because there's no new debt filling the back end of this. Payment is made on highways and bridges, bonds, generally with the gas tax, among other resources. We also had a very small amount left outstanding for the airport maintenance facility bond. For those that were around long enough that can remember, it was the United Airlines maintenance hub back in the late 80s, early 90s. I can say that these bonds were actually paid off November 2018. So that $18 million was paid off just last month, so that's off our books. We also had a small amount outstanding for an aviation technical center run by Vincennes and Purdue Cooperative at the Airport Authority. Those bonds were also paid off in fiscal year 2018. All the transportation debt we have outstanding is 100% fixed rate, which we try to be as conservative as we can and lock in the fixed rates. Next one is what we call the fee replacement bonds. It's debt issued through the universities or by the universities, and then the state appropriations reimburse the university for the debt service. The fee replacement bonds must be reviewed by the Budget Committee and approved by the Budget Director and the Public Finance Director, so there's a number of levels of checks and balances when the universities do go out and issue debt. The debt outstanding will continue to grow over the next year based upon authorization of new projects that have yet to be financed. Currently, where we're at as far as entity by entity, IU has about $310 million of debt outstanding, Ivy Tech $211 million, Purdue $165 million, Ball State $140, University of Southern Indiana $65, Indiana State $83, and Vincennes about $47 million. We mentioned the Indiana Stadium and Convention Center debt that was issued back in, I think, through 06 through 09, if I remember right. The majority of the interest rates on the Stadium Convention Center bonds are now fixed rate. I think our portfolio on Stadium Convention Center bonds is approximately about $600 million that's fixed rate and about $400 million that's either a variable interest rate, floating rate, or has a swap to it. When I came on board at the IFA, that mix was a lot stronger the other way. It was 30% fixed, and more of it on the variable and swaps, and we've worked through that to try to get more fixed rate locked in as the revenue streams have continued to improve. As I mentioned earlier, the repayment sources for these bonds are the local food and beverage tax, hotel, rental car tax, admissions taxes, and Colts license plate fees. The revenues since inception to the current time have always come in ahead of the lease rental or debt service payments. We're also filling I call it a debt service reserve bucket. Each year, any excess goes into that bucket. It's been building since 2006. It's currently $55 to $56 million, and we anticipate that to continue to grow each year. Again, showing that we're building kind of that debt service reserve for another economic downturn, should we need to have it on hand if we see a revenue drop. But revenues right now are steadily increasing ever since the Super Bowl. We've seen a steady increase in those revenues. State Office Building Commission, a lot smaller projects listed out there. We issue debt on behalf of the Department of Administration, Family Social Services, and the Department of Corrections. This portfolio is 100% fixed rate also. You can see the larger ones are Wabash Valley Corrections, $45 million, Newcastle, $45 million, Madison State Hospital, $34 million, Logansport State Hospital, about $17 million, Evansville State Hospital, about $14 million. And then the Department of Corrections has some energy cost savings leases of about $16 million. And the largest one you see down there is the Neurodiagnostic Institute. That was a facility that was approved for debt issuance about 2+ years ago. I can tell you, in checking with our person who's been monitoring the process on the construction, it is being built on Community East Campus, and we'll have access to the Community East Campus for patients that are there, along with shared services. They are on schedule they are ready to open on schedule, March 2019. And as of last week's update meeting, they are still on budget and slightly under budget. So that's always a pleasant story to hear when you're seeing a $150 million project being built. We discussed the Indiana Bond Bank moral obligation debt a little bit earlier. The bond bank provides assistance to local units of government in funding special projects with the use of bonds, including water and sewer systems and capital improvement building projects. I would say the one thing I would add here is they have to be there has to be an essentiality of use for these projects. They can't be for something that's not part of the core business of these entities. You look at the list out to the right, Hendricks County Hospital has about $84 million outstanding, Adams County about $28 million, and then South Bend TIF District $16 million, Columbus Learning Center, which is an interesting one. It's a joint venture between Ivy Tech, I think Purdue, and the local school system, along with local unit government Columbus. We had 4 entities participating in that Columbus Learning Center. Fort Wayne Regional Safety Academy is about $9 million, and then a couple smaller ones for the City of Carmel and Carlisle Utilities, and then a number of smaller pooled bond issues. One of the things the bond bank used to do is take small water and sewer transactions that didn't qualify for state revolving fund and put them together into pools so they could save on underwriting costs, legal costs, and financial advisory costs. Right now, moral obligation debt outstanding is about $212 million. That amount is dropping off by about $20 to $25 million a year. The main reason for that is since 2009, the bond bank hasn't issued any new moral obligation debt. And again, as a reminder, the moral ob has never been called on since the bond bank inception in 1984. The Recreation Development Commission projects we partner with the Department of Natural Resources to finance or refinance costs of acquisition, construction, or renovation and equipping facilities for the operation of the public parks. The majority of the payment for these bonds is actually income the parks generate, the inns generate. So again, the appropriation is not utilized to pay these bonds, but the revenue is being generated by the state park inns. Very small amounts outstanding right now. We have multiple projects at the Clifty Inn, Abe Martin, Prophetstown, and Fort Bend. It's about $13 million. The final payoff on that is about 2026. And there's a small amount left outstanding for a Clifty Inn, Abe Martin project, about $1.6 million. That will actually pay off in July of 2019. So when we come before you again, those will be paid off also. IFA is also involved in public partnerships. There is one that actually does affect the state's debt burden. It is the Ohio River Bridge Project, or the East End Crossing between Jeffersonville and Louisville. It's used a model at one during the construction period. There are milestone payments made to the contractor, so they get a certain amount of payment from the state as they can complete the project. And then once the project is up and running, we make availability payments to the operator for keeping the road available, and there are all kinds of levels of service they have to provide across the board on that project. As I mentioned earlier, we also utilized a lower interest rate loan from the, I never say this right, so Transportation Infrastructure Finance and Innovation Act, or TIFIA. We utilize that as part of this package also. The rating agencies do look at the amount of private activity bonds that were issued by the developer. They are direct responsibility of the developer, but since the state is making those availability payments, they view it as debt of the state of Indiana. So in total, the Ohio River Bridge project has about $629 million that the rating agencies look at as a debt, part of the debt burden for the state of Indiana. We'd mentioned non-appropriation backed debt also. The bond bank, in addition to issuing moral obligation bonds, do issue non-moral obligation bonds. They do have about $628 million outstanding. The majority of that was a school pension bond program that was done through about 2002 through 2006 or 7, or allowed schools to issue actually general obligation or property tax backed bonds to help shorten their pension liabilities. The other thing the bond bank does is issue tax warrants for local units of government. Local units of government only get their distributions in May and November. If we were operating our checkbook in May and November only, it'd be pretty difficult to budget for that. So what the bond bank does is provide them funding in January and June so they can have a better way to deal with their cash flow. The state revolving fund has about $1.3 billion of debt outstanding. All that is purely based on the cash flow of the state revolving fund, the fund balance. There is no state exposure to state revolving fund debt whatsoever. The program gets a certain amount of funding from EPA each year, and we use that to subsidize rates to local units of governments for clean water and clean sewer projects. And there is a small amount of debt outstanding at the Indiana secondary market for educational loans, about $82 million. We'd mentioned the public university debt again, about $1.6 billion. The Housing Community Development Authority, which assists with provides again subsidized rates for qualifying housing projects throughout the state, about $424 million. And the Ports of Indiana, I believe, has one small bond issue outstanding, issued a few years ago. It was $10 million. Now it's down to $7 million. Touch on the oversight one more time. Bond bank, non-moral obligation debt. We still are a board member at the bond bank, but it doesn't require any review by budget committee at all, since there's no state moral obligation involved in that. State revolving fund is issued through the IFA. Public finance director is involved, and then our chief operating officer at the IFA is also our director of environmental programs. Jim McGough is with me today. Indiana secondary market for educational loans, when they do go into the market, they do have to make us aware of it, provide us information about it. Mentioned our partnership with the public universities. We are also a board member for the Indiana Housing and Community Development Authority. Ports of Indiana has to provide us an update if and when they're going to market with any bond offering. State Fair Commission, their loan bond issue that they've issued has flown through the IFA, so we have oversight on that also. The last thing we try to walk through each year is there is a small appropriation that's given to our brownfields program. It's part of our environmental programs. Senator? Brownfield. Yep. Kind of walk through one, history of what we've done here and why, and then the appropriation history, and then the request for this year. There was something adopted called a Petroleum Oversight Initiative. In 14-15, appropriation enabled the IFA to create this Petroleum Oversight Orphan Site Initiative. It was created to address petroleum contamination on brownfield sites throughout the state resulting from leaking underground storage tanks. Cannot be addressed by the responsible party due to inability to pay, bankruptcy. A lot of the reasons you see some of these areas being left empty and being unable to redevelop until we get it fixed. In the past years, we've received $3.3 million a year was transferred for state fiscal years 14 and 15, 2.91 in fiscal years 16 and 17, and $3 million transferred for fiscal year 18 and 19. Kind of a list of what we've accomplished here, and Jim, be glad to answer any questions. We had 57 sites approved for funding in 45 communities, so I mean, those areas can now be developed. Almost $11 million been obligated. $8 million of that has already been approved to be spent. Our average project budget is about $200,000, but you'll see the high of almost $800,000, a low of $22,000. So it's, we try to work with the larger ones and the smaller ones. They're all important to get cleaned up. We've had 22 no further action letters issued, meaning the property's good to go forward. 2 site status letters issued, and 5 no further assistance are in draft. We've had 67 underground storage tanks removed, 4 closed in place. 7 fuel underground storage tanks have been removed. 3 hydraulic lifts have been removed. Our request this year, per year for 20 and 21 is about $2.5 million a year. So that's the loan appropriation request the IFA makes upon the legislators each year. I know I walked through a lot of stuff. Glad to answer any questions.
Thank you, Mr. Chairman. Dan, quick question. I know I've asked this, but I forgot. The public university's credit rating, does that tie to our credit rating at all, or is that an independent rating provided by the rating agencies? Just kind of understanding that relationship.
Yeah, I think the state's AAA rating helps the universities with the ratings of their bonds. We've seen Illinois universities actually see their rating agency drop because of the credit strength of the state and concerns over when they're going to get their appropriation payments. So there is a direct linkage there. While I don't believe any of them have a AAA rating, it does help with their AA to AA minus ratings. Is that fair, Mark?
Yeah, it's fair. They get their own ratings, but the state's support is very important in formulating that rating.
Yeah, we watch a lot of the community college and smaller universities in Illinois that were state-run see some, we're talking BBB downgrades. So, good question, Jason, or Mr. Budget Director, sir.
Thank you. Sorry I was late. A couple questions. None of the South Shore project, NICTE projects are in here right now? Is that
Correct.
okay? Just because they haven't been approved by the feds yet?
Yeah, I'd be glad
Yeah,
to give you a
right, okay.
quick update. Westlake is currently, the application was sent in September.
Yeah.
It's under review. We're having regular conversations with the FTA. They have a financial management consultant and a project management consultant. Those are ongoing. I would say we see hopefully mid-spring, late spring, we would see the next action from the FTA.
Okay. And just about this brownfield appropriation, I remember that this used to be under IDEM, and they did all of these. Didn't they have a revenue source that contributed to this?
Is that I'm going to venture to ask, and I'll ask Jim McGough, our director, to come up. Is that what was coming out of the Excess Liability Trust Fund, Jim? Exactly. So that was the revenue source. It just got transferred over to our environmental program center.
All right, so is that trust fund money, is it still receiving payments?
Yes, I believe so. IDEM would be more equipped to answer that question directly, but it's my understanding that they still receive revenues from any facility that has a tank in the ground.
All right, so the $2.5 million appropriation that you're asking for the brownfields, is that something that's separate from that new general fund money, or is that coming out of that trust fund?
Actually, that's been at budget's discretion in the past, so the appropriation request previous to 14, 15, or I guess in the early 2000, late 90s, it was an appropriation, just a general appropriation, and then over the last 2 or 3 funding cycles, rather than an appropriation from the general fund, it's been a appropriation out of the excess liability trust fund.
It is out of that fund. Okay, so that fund is not sitting there building up money, and we're using general fund money to clean up brownfields. Okay, that's what I wanted to know. Okay, thank you.
Thanks, everybody.
Next Monday, the 17th, at 10 a.m. in this room, and we'll have the revenue forecast, Medicaid forecast, and then we'll have our business meeting after that. So if there's no other questions, we'll go ahead and adjourn.